Hello and welcome, and it's great to see so many people here interested in our organizations and advocacy. Thanks so much for the opportunity to speak to you. Dr. Osler and I have many things in common as presidents of the CMA and AMA, and one of the most pleasant experiences is the ability to engage with young leaders like you in this room. Medical students are not only the future face of medicine, you're the face of the associations that will support you. We really value opportunities like this to spend some time getting to know each other and learning about your hopes and expectations for the future. I was asked to give a brief overview of issues facing the Alberta Medical Association, and by issues I mean the things that are affecting the decisions that the AMA Board of Directors has made and will be making as we guide the AMA through these complicated times. As I thought of all the topics I could cover, I was reminded that the things that are happening today in our healthcare system are all connected. As the medical profession, we can't afford to think of them as separate things, or we will fail to achieve that we could achieve through a more integrated approach. So today I will share some thoughts about the environment in which you are training to become skilled and compassionate physicians, what may lay ahead for all of us, and where I think some of the solutions and opportunities exist. In terms of the environment today in Canada, all governments are concerned about the steadily increasing growth of healthcare budgets. In Alberta, spending growth at the current rate could consume about 50% of provincial expenditures over the next decade or so. Alberta also spends more per person than most other provinces, and why this is unclear at this point. What are the options that government might consider? We know slashing healthcare budgets doesn't work. Spending that gets squeezed in one area tends to rebound in another. We know physicians and other healthcare providers are already working very hard for a population that is aging and still growing in Alberta. We'll do our part, but just working harder in the same ways isn't the solution either. We all need to remain healthy and resilient, or we won't be there when our patients need us. Technology can help, and there are many exciting things happening in that area. But technology may improve efficiencies and fill some gaps, but it doesn't necessarily reduce costs, and it costs money to implement and create culture change. Changing payment systems and incentives can help. We can reward people for delivering the kind of care that people in certain populations need, and that may or may not cost less. There's also the issues of physician supply, something that will directly affect all of you in this room. And students are involved in a provincial planning committee under the AMA agreement to develop a needs-based physician resource plan. The goal is to identify the supply, mix, and distribution of physicians that Albertans require. That's a work in progress, and it may mean we have to think about our futures a little differently than you have already. Most of the growth in physicians' expenditures in recent years has come from more physicians setting up shop in the province. It's great to be a province of choice for physicians, but we need to have a good idea of what's needed and how to get physicians where Albertans need them. These are only a few of the elements in our environment that the AMA is trying to address. We're guided by our vision statement of a high-performing healthcare system. Physicians are willing to be responsible fiscal partners, but it's clear that we won't succeed by focusing on cost as the first priority. Instead, we should think about something more important: value. Value from the healthcare system matters because it's something that patients and taxpayers deserve. It's also something that organized medicine can also recognize and appreciate. When both patients and medical professionals value and aspire to the same things, we can make good things happen. When organized medicine can work effectively with their governments, and the AMA has done so for decades, we can find province-wide solutions that provide what Albertans need for harnessing the leadership and stewardship of physicians. Value for patients, value for the system, value for physicians, value for governments, all come together under one concept, and that's sustainability. And when you hear the AMA talking about contributing to a sustainable system, you can know that it's that is fiscally prudent, but also provides quality care for patients, delivered by healthy medical professions. We're very fortunate in Alberta to have a strong foundation for bringing these ideas to reality. For example, we have primary care networks caring for over 80% of Albertans with team-based care and under the model of the medical home. There are 42 PCNs, which would normally make population decision-making rather difficult, but we have over the last while established a PCN governance framework that PCNs caring for their local patients actually have an opportunity to participate in provincial decision-making and provide input to the government. We have what I believe is the highest percentage of physicians in Canada using electronic medical records. And through the AMA, we have the largest program in Canada to support physicians in transforming their practices to create a medical home for every Albertan. Very recently, we have begun looking at how to turn that medical home outward and connect it with a health neighborhood. These program supports will be able to guide the profession through the changing practices toward the goal of a fully integrated primary care system, including primary care and acute care. All these innovations have come from agreements between the AMA and the provincial government, and we look forward to continuing partnerships to pull greater value from the system. The early benefits have been encouraging. Research in Alberta and other places have shown, for example, that patients with a medical home have fewer ER visits and hospitalizations. They have improved access, improved results in preventative care, improved overall quality, and improved patient satisfaction. That sounds like a good beginning to me. And here are some of the things that are working on our partners for the next phase towards that health neighborhood. Sharing information from community electronic medical records so that information can follow the patients, and a robust EMR is essential for that. Ensuring that every Albertan has a family physician to call their own. Taking advantage of technology for the electronic visits and virtual care, and new payment models in primary, acute, and academic settings that compensate physicians in ways that make sense for the patient populations that they serve. I could go on, but my time is nearly up. But let me conclude by returning to something that I mentioned earlier today, and that's this power of stewardship and leadership, and why I think all of you are here today. Stewardship is a professional responsibility and core competency of physicians. Beyond that, it's also embedded in the social contract between society and physicians. Society provides our professions with benefits of not only our education, but also autonomy, trust, and self-regulation. In turn, we provide compassion, availability, accountability, and altruistic service. Continuing our contract with our patients and society will cause physicians to step up in new ways and make decisions that are based on maximizing value in the system. We will learn to make more decisions together. We will be leaders in seeking to keep expenditures at a sustainable level. We will think of payment not as a goal, but as a means to the ends and a high-value system. We may have to look hard at ourselves, how we practice, where we practice, with and with whom, as we work towards those goals. As a past AMA president said a few years ago, every time you see a patient, think of it as an opportunity to reshape the healthcare system. We can do this by positively shifting the social contract equation to improve the relationship, not only with the patient, but also with society in general. Ultimately, this will create both provider happiness and system success. Management changes cannot do this. We can do it only through the individual choices each of us makes every time we interact with a patient. I can't think of a better challenge to leave you with. Thank you for listening, and if you have any questions or comments, I'll be glad to hear them. Thank you.